Dr. Pamela Ruegg. I hold the David J. Ellis Chair in Large Animal Clinical Sciences at Michigan State University. And in today's video, I'm going to be talking about how we interpret and use culture negative results of milk samples from cows with mastitis. Now, these culture negative milk samples are not an unusual occurrence. If we take milk samples from cows with mastitis, take them to a laboratory, approximately 20 to 50% of the samples will end up as no bacterial growth. This is normal. In fact, if you have culture results, something growing, from all of the milk samples that you submit to a laboratory, that means probably the sampling wasn't clean enough, and some of those are contaminated with bacteria from teat skin or the environment. So 20 to 50% of our milk samples usually result in no microbial growth. Now, to understand how to interpret these samples, there's a few things we have to think about. First of all, what is the detection limit? By detection limit, I mean, if we have a milk sample that we take from a quarter that has mastitis, and we take it to a lab, how many bacteria have to be in that milk sample in order for us to detect it? Because when we take that milk sample to the lab, we don't take that whole milk sample and pour it on our agar plate. What we do with that milk sample is take a little sample of it. We do that with either a swab that we put into the milk sample, or we take a loop with a defined volume where we capture a little sample of that milk and spread it on our agar plate. In most laboratories, the use of these loops or swabs means that if we see one colony growing on that plate the next day, that means there's about 100 colony forming units of bacteria in that milk sample. So one colony on a plate is our lower detection limit, and that's about 100 colony forming units per ml. If there's less than that in that milk sample, then we typically can't detect it. Now, when we get a culture negative result of a milk sample from a cow with mastitis, we've got two real options for why we could get that. One could be that it's truly a negative result. That means while we're seeing inflammation, either abnormal milk and a swollen quarter, we collected that sample after a successful immune response has already reduced the number of bacteria in that mammary gland to below our detection limit. In other words, that quarter is basically bacteriologically cured. And that's typical of clinical cases, especially clinical cases caused by E. coli. So a true negative result is a good outcome. The other reason we could get a culture negative result is a false negative result. Now, you got to listen a little bit here because this is a little confusing. Let's say we go to a farm and we take a milk sample from the quarter of a cow that's got a chronically high somatic cell count, meaning there's millions and millions of somatic cells or neutrophils in that udder trying to fight bacteria. The presence of those somatic cells tells us there's an infection going on because there's no reason for them to be there in a healthy gland. But when there's millions and millions of these neutrophils in the mammary gland fighting the bacteria, there's very few bacteria left because the purpose of that inflammatory response is, of course, to engulf, destroy those bacteria. And sometimes that ongoing inflammation fails. We continue to have these chronically high somatic cell count quarters, and we can take milk samples from them, but we can't ever find the bacteria. And that's because that immune response isn't successful in eliminating the infection. It's just brought it down to below our detection limit. That's really common with pathogens such as Staph aureus. So we can have true negatives or we can have false negatives. Now let's talk about some thumb rules for how we can use and interpret culture negative milk samples. First of all, let's say we get a culture negative milk sample from a cow who has clinical mastitis. That is normally an outstanding prognosis, especially if it's a non-severe case of clinical mastitis. About 85% of the time, the research has shown that's a true negative. What we've done is we've simply seen the signs of inflammation, the abnormal milk and a swollen quarter, after the cow's immune response has successfully eliminated the bacteria. The prognosis of these cases is excellent, and this forms the basis for some of our selective treatment programs for non-severe clinical mastitis. On the other hand, let's say we take a milk sample from a chronically high somatic cell count quarter, subclinical case, and it's culture negative. That isn't so great of a prognosis. In many instances, those are chronically high quarters that the immune system has failed to eliminate the bacteria. These quarters intermittently shed bacteria. The milk can be infectious to other cows, and we need to make intervention decisions about these cases, such as segregation or culling the cows. So in these instances, this is a failed inflammation, it's a false negative, and it's a poor prognosis. So let's recap. Culture negative milk samples indicate good sampling technique and occur in about 20 to maybe even 50% of all the milk samples that we collect for mastitis. When we have a culture negative milk sample from a clinical case, the prognosis is often good. However, if we get a culture negative sample from a chronic subclinical case, it may indicate failed inflammation in a long-term case that may require culling or another intervention. You can review some of our pathogen-specific videos to get more details on those interventions.